Sometimes the shoulder pain is originating from the neck, and you really feel that shoulder is painful. The examination of the neck will be positive, and the shoulder range of motion may be painless. Sometimes, since you feel pain in the shoulder, you don't move it, and because of not moving it, you also develop some shoulder problems secondarily. The moment you treat the neck nerve root problem, you easily get rid of the shoulder pain, and then just you have to do range of motion exercises. Welcome to Dr. Nasar Shahid's forum for how to achieve well-being, how to prevent chronic diseases and chronic pain. In the last vlog, we talked about shoulder. Shoulder pain could be very annoying. Sometimes the shoulder pain is originating from the neck, and you really feel that shoulder is painful. How you distinguish that? So that distinguishing between the origin of pain, that is being referred to the shoulder, but the origin is in the neck. And interestingly, sometimes there is no neck pain, but it's coming from the neck. What happens is, if the nerve is being supplied to the shoulder is at the level of C5 and C6, if these two nerve roots, they are inflamed or they are being impinged by a disc, you might feel pain referred to the shoulder. In that case, the examination of the neck will be positive, and the shoulder range of motion may be painless. Sometimes, since you feel pain in the shoulder, you don't move it, and because of not moving it, you also develop some shoulder problems secondarily, that the redundant capsule gets adhered to the bone. So again, this distinguish actually is very important, because the moment you treat the neck nerve root problem, you easily get rid of the shoulder pain, and then just you have to do range of motion exercises. Another problem with the shoulder is that the shoulders are our means to use our upper extremities, our elbow, our hands, our fingers, our grip. And since we are not using it properly, in certain sports, they are vulnerable to get, like, if you are playing cricket or baseball or badminton or tennis, you can injure your shoulder. And similarly, when you are lifting something in a wrong way, that can also create some pathology. The best way to prevent those things is that, say if I have to lift something from here, I should move on this side and lift that thing on the front. So whenever you are moving, lifting something, bring your whole body there and just lift it, because that will be very protective for your shoulder. Lifting like this can make it vulnerable to any tear or injury. That may not be apparent right now, but maybe in the future, because of accumulation of injuries, you can start having shoulder pain. Shoulder pain is also very annoying when you are sleeping on that side. The reason is, there is a watershed area. So some area, they get less blood supply because of the gravity, and as a result, you feel more pain and your sleep is disturbed. Remember, sleep has a therapeutic value. If you sleep properly throughout night, especially in the early part of the night, any injury will get healed. Your repair is maximum when you're sleeping. Now, since because of the pain, you're waking up and it's being interrupted, that interferes with the healing system. So having a good sleep, that will help you heal quicker. So the shoulder pain, distinguish between neck and shoulder pain, treat it conservatively through proper use of your hand and extremity. Whenever you have to lift something, move your whole body there and then lift, rather than lifting from the front or from the side or on the back. So hopefully you will understand these shoulder issues very easily, and whenever there's a problem, please consult your doctor.